Aetna Insurance Company has a program for their patients where they can pay a little bit extra money and they can see doctors out of the network.
Right.
So now the doctors are suing Aetna Insurance for not paying the doctors for these services. But what's the other side of this story?
Well, there's a lot to it. This all boils down to follow the dollars. See, earlier in the year, Aetna sued doctors because they were charging exorbitant fees. For example, they were charging $37,000 to do a lithotripsy, which is where you break up kidney stones, and it would cost Aetna maybe $7,600 to do it within plan. So that was only about 5 times as much, and they felt that wasn't right, so they did a lawsuit against them and said, you can't do that because it's too much money. So the doctors got together later, and what they're doing now is they're suing Aetna. And they're suing them, saying that the patients are entitled to have services that they've paid for, and out-of-network services should be part of what they should cover.
Well, you can see both of their points of view.
Well, you can, but I mean, they're both being unreasonable. I mean, it's all about how can I make the most money? The insurance company wants to pay as little as it can because then it's more left over for them. And the doctors want to bill as much as they can get the insurance company to pay. So now they're fighting about it like little kids.
So they're not doing what you would call patient-centered care where the patient is the most important thing. I mean, we want the patient to be well and to get better and to have their lipotripsy or whatever.
Well, see, it's not just that. You're looking at the LA County Medical Association. We're also looking at the California Medical Association actually sponsoring the lawsuit. So what you have is a union, basically, fighting another organization about business and who's going to get what for what they do. And this is common practice. You see this all the time. Hospitals do this with insurance companies. It's not just doctors that do it or doctors' organizations. Because when you get a bill from a hospital, it might be, like in my case, it was $89,000 for a hip replacement that went bad and were lots of complications. Now, they probably got paid something like $10,000 or $15,000 for that because the billing is quite a bit higher. And that all goes into they take that into account. But if a private patient comes in and they're paying, they get that $89,000 bill. So there's something wrong with the way the system is working. So one's suing one, the other's suing the other to come back. And what you have here is a system that's just telling us that everybody's greedy and they're not working together like they should.
And it sounds like at the beginning, you know, like, isn't that nice of Aetna to allow their patients to see doctors out of the system?
Well, it's not quite just like that. They'll allow you, if you've got an HMO plan, for example, you can't do that. If you do, you have to pay the doctor. If you've got a PPO plan, very often what that means is that they will pay something towards that out-of-plan doctor, but they always pay more to their own doctors. So their own doctors might get 80 or 90% of what the bill is if you're in that plan, a doctor that's in that plan. But if you're out of plan, you're not going to get anything. So you're going to have to pay the whole bill yourself. Mm-hmm. So they're in this for the business too. And unfortunately, that's what we're talking about is a business proposition here. It's not like we're in a big club where we're working together to try to make things work out. And I have to say, I don't have a real soft spot for the insurance companies. I don't really have a soft spot for the doctors. And the patients are the ones that are in the middle of it all. And I can tell you, a few years ago, an experience that I had with Aetna Insurance myself.
Oh, yes.
You know, where they're wanting to conserve as much money as they can. The idea is to cut their costs. And so I ordered for one of my patients a couple of tests that they don't know much about. And so they wind up saying, well, we're not going to pay on these services because we don't think that they're right, that they're worth it. They're not
just
approved.
Just because they didn't know about them.
Well, okay. So they just weren't going to pay for it. So they talked to one of their consultants at one of the local medical centers, and the doctors there didn't know anything about it. So the next thing they did was they called the state medical board. And they said, we have this doctor here who's ordering tests that we think are bad tests, and we want you to go prosecute them. Without doing much other checking, they call me up. The medical board calls me up and says, is this Dr. Len Zaputo? And I said, yes. They said, go get an attorney because we're coming to take your license away. I said, what? For what? They said, we don't have to tell you. It's like militaristic stuff. We've got all the control. We don't have to tell you. And by the way, we want you to send the chart. And if you don't within 7 days, we'll charge you $1,000 a day. That's how things were at that time. So I had to hire an attorney, spend about $20,000 to finally show them that the very tests that I was ordering were tests that they were giving continuing medical education credits for, but they didn't realize it. So they've got egg all over their face, and what do they do as a way to get out of it? They say, your chart notes don't look that good. we're going to fine you $350 because we
They're going
don't
to
like
slap
it.
your wrist.
So that they're going to be right, okay? So that's not the end of the story. By the way, my patient was happy, never had a problem the whole time. It was the insurance company that didn't want to pay on the test that helped him. So in 2004, I'd had enough, and I joined with California Citizens for Health Freedom, Frank Cooney's organization, and we went to Senator Vasconcellos at the time, John Vasconcellos, and drew up a bill, okay, that was for people being able to order any test they want, do any procedure they want, so long as they weren't trying to convince people that they couldn't do the natural things that were in the mainstream of medicine, and so long as they didn't hurt the patient. So that law now exists, and insurance companies can't do what they did at that time. But it's still a problem, and it goes to show you that this is a money-driven system. It doesn't really have to do with what are we going to do that's best for the patient. So this whole business about the lawsuits is reflecting the greed on both sides, not really looking at the right thing to do. It's limiting services that people can get. There's no health freedom in this country, and that's what's happening. So we all have to mature by evolving to a higher level of consciousness where we put service first and we put finances where it should be last.